More than 9 months since the Covid-19 pandemic was reported in the country, the infectious disease continues to ravage people of all walks of life. 30 health workers have died, and that number includes 10 specialist doctors with several years of vast medical experience among them. The health workers now admit that they are at a higher risk of contracting the disease as the government continues to record higher numbers of infections, while some Kenyans continue to treat the disease with little or no care at all.
This is the story of doctors and other medical practitioners, the frontline warriors coming face to face with COVID-19 every day, with the country now facing an upsurge that has been called a second wave. When the first case of COVID-19 was reported in the country, the nation went on red alert. Nairobi, which was then the epicenter, was cut off from the rest of the country. A nationwide curfew became the norm as county governments scrambled to put together isolation centers in the face of what the government described as the invisible enemy. But rarely mentioned in the pronouncements were the real warriors who are already gearing up to wrestle that unseen enemy.
The occupation itself has placed you at risk.
But the events of the last few days have put the plight of these frontline soldiers in the limelight, with at least 30 healthcare workers having died from COVID-19 related illnesses since the pandemic began. Thursday at the St. Paul's Catholic University Chapel in Nairobi, and Dr. Jacqueline Njoroge is being eulogized by her family, friends and colleagues. Dr. Njoroge is one of 6 doctors who died within a week. Like many who have passed on, she was described as someone who lived a selfless life.
We will miss her very much. She was a very dedicated soldier.
Dr. Njoroge started off at Equity Africa, a private medical franchise in Thika and Kahawa. She decided to channel 10% of their revenue to Equity Foundation to help subsidize medical costs to poor patients. The 38-year-old medic breathed her last on Saturday while receiving treatment for COVID-19 at the Kenyatta University Teaching, Referral and Research Hospital. She is survived by her husband, Joshua Chokera, an engineer at Kenya Power, and 2 children, Adrian and Angel. 10 of the doctors who have died so far were senior specialists with many years of experience. They include Dr. Adisa Lugaliki, a gynecologist, Dr. Ndambuki Mboloi, a pulmonologist, Dr. Daniel Alushula, an orthopedic surgeon, Dr. Vladimir Shukin, a bariatric surgeon, Dr. Hazan Inyangala, a public health specialist, Dr. Emara Ashraf, a plastic surgeon, Dr. Robert Ayisi, a pediatrician, Dr. Hudson Alumera, a periodontal surgeon, Dr. Faith Mbuba, a pharmacist, and now Dr. Jacqueline Njoroge, a physician.
Doctors have really undergone a lot of strain, and then there's been burnout because of a serious shortage. So you can imagine for 8 months, and then bring that on board, a delayed salary, an unremitted deduction of your NHIF.
This is Dr. Hudson Alumera at a past function, long before the pandemic hit the country. He was always in a jolly mood, entertaining colleagues when not on duty. At work, he was said to be compassionate. The doctors and medical practitioners say they no longer feel like heroes of a war that cannot be won without their input.
And a lot of time they parade themselves in front of cameras and give inaccurate information about how prepared they are without admitting their defaults or admitting the weaknesses in the systems they have in the different counties. It is such a shame. It is a shame to the fabric of the nation and our own morality as human beings. Because you can't have someone say, I have an ICU bed, or I have 6-bed capacity of ICU with ventilators, and it is a lie. Which message are you sending?
For many health workers around the country, going to work is now a new hazard. They are no longer sure whether they'll be back home once they reach the hospital or private clinics.
You'll see like lung tissue remains like ni kama wajua venye mtu amechomeka hivi. Yale makovu. They eat up, it eats up the whole place.
Dr. Yubrin Mora is an internist and is specializing in cardiovascular diseases. She has 2 children. Like many of us, she has had to change the way she interacts with her children and other family members. At work, like many other doctors, she is at risk of contracting coronavirus from patients and even colleagues. Life is now far from normal.
I'm talking to a Kenyan patient and I've seen several of them and I tell them, you know what, you're coughing. If you have this and these symptoms, it could be likely be COVID. But you know what? They're in denial and they say this is not COVID because I understand it's because of stigma. So they go and lie. They lie about their symptoms.
The hospitals that were once considered safe environments are now a red zone. Dr. Catherine Nyongesa runs the Texas Cancer Center in Nairobi. On a daily basis, she treats some of the most vulnerable members of society. She also doubles up as the head oncologist at the Kenyatta National Hospital. She has interacted with hundreds of patients from both hospitals, and she knows the risk is real.
What we understand is that any person you interact with, there's a potential that they have COVID-19. So the more the people, the more the chance of you getting the COVID-19.
Dr. Nyongesa says specialists have no choice but to attend to those who are sick, but now it comes with extra caution.
Doctors, nurses, and other medical fraternity, they are just human beings like anyone else, and if they fall sick, obviously they need care. And when we need care, we need also to have access to a hospital in case we need ventilation or oxygen support. We need all those things to be available.
After that diagnosis, and it's over me now.
Dr. Chibanzi Mwachonda contracted the virus while on duty. As the acting Secretary General of the Kenya Medical Practitioners and Doctors Union, he has to go around the country to assess the working conditions of his fellow doctors. It is on one of these routine visits that he contracted coronavirus.
You'd understand that when a doctor dies, then it's a ripple effect that it could be me.
For him, isolation was the worst period while recuperating. At one point, he almost gave up, he says.
And it's a lonely disease because when you're sick, people come and see you. But in this case, no one really comes to see you. And I think at some point, I had given up. I was like, I don't think I'm going to make it. And I woke up and I was like, did I just dream that I was dead?
He says he is heartbroken not just by the inadequate protection for health personnel, but even more by the public attitude towards their work.
Kusema kweli hapa baniliko tunavaa mask kwa sababu ya polisi. Wanatushika, hiyo pesa wanachukua na wanaweka kwa mfuko.
Kataa kujiunga na hii serikali ya kuweka hii barakoa na kuweka social distance na kuosha mikono utakufa.
Addressed, and it is also important.
Dr. Mwachonda is fully recovered now and continues to carry out his duties. Only this week he led a team of KMPDU members in a meeting with the Parliamentary Health Committee to discuss the plight of the health sector. The proceedings hit the headlines as some legislators shed tears in front of cameras on hearing the harrowing tales from the practitioners.
Make it public that the following local manufacturers of PPEs have been verified by the ministry, by the end users, which is us.
Who says patriotism is suicide? Patriotism is not suicide. You cannot ask a person to jump into a river that is running because they are patriotic. I don't like this.
According to the healthcare workers, most of the facilities they work in lack PPEs, and some are said to be of poor quality. In many cases, doctors in public healthcare facilities are forced to use PPEs for several days, or in some instances, share them, despite the government claiming that there are hundreds of thousands of these kits gathering dust at KEMSA.
We have got 300,000 PPEs at KEMSA. We have said that even though KEMSA bought them at a higher price because of what was happening at that time, we have said going forward, any county with any shortage of PPEs can draw any quantity that they need from KEMSA.
According to the CS, hospitals should request for PPEs when they require them, but the doctors insist that the PPEs should be on standby at nearby locations for quick deployment. KMPDU disputes the claim that there are enough isolation centers in the counties. KMPDU says it has documented cases where some doctors who tested positive for COVID-19 have had to isolate inside their cars at home for fear of spreading the disease to their family members.
This did not just come from the children. It came from the parent of the children who said, don't play with the kids of that family because their mother is a doctor. They discriminate against them.
KMPDU says over 2,000 doctors are required to be hired to cope with the current surge and future needs. They also want the existing risk allowance enhanced in all the 47 counties. But the doctors say the biggest threat to their lives right now is the growing public complacency. Many Kenyans have since stopped wearing masks or wear them wrongly. Many more are no longer washing their hands or sanitizing as frequently as they once did. In fact, Matatu operators, for instance, have since stopped buying sanitizers for use by passengers. The frantic fumigation of public markets and even the streets by county governments has since disappeared as complacency sets in. This here is a real-time recording of how the lungs of a COVID-19 patient are affected. It is a time-lapse recording from a patient who succumbed to the disease recently. According to doctors, the lungs of a patient who has contracted the disease can collapse within a period of 5 to 14 days. Death is inevitable then. A grim reality that ought to drive the point home that COVID-19 is real and that the doctors and other healthcare workers have to pick up the pieces when public behavior slackens. They are hopeful, however, about the news of possible vaccines that have given promising results, but those are still a long way off, and until they arrive, observing the health measures is the sure weapon. Nimro Tabu, Citizen TV.